Chairman, I can advise that the live stream's back up and running.
Thank you, Tracy. Go straight on, and I had one speaker come in during the break, and that was Councillor Ellenbrook. Barbara, please.
Thank you. Right, okay. My question is about self-funders. If they don't want to sell their homes, they can apply to defer. So the council pays and collects their payments made from the person's estate or during the period while the house, if this is the only sole asset, is being sold. So is this added with interest to the person's overall liability?
Thank you, Councillor Ellenbrook. So
I think that made sense.
yes, it makes absolute sense. So you're absolutely right that if somebody needs to go into a residential care home, that there is an arrangement where they can apply to us to defer their payments, which in effect is an interest-bearing loan. That is charged against the value of their property, and we will continue to make their payments for their residential care until such time as the equity in the property has been exhausted and we need to recover the money. There's an interest rate which is applied to that, which is adjusted twice a year and is set by the government, which sets a maximum amount that we are able to charge on the amount of money that they defer.
Okay, thank you. So does that mean that you only take the money from the estate up to a maximum amount? Is it something like £20,000 or something like that? If their assets are below 20,000, then you don't take the money?
So what we do is we undertake a valuation on the property to determine the amount that we can advance to them without incurring a debt risk on the council.
Right, okay, thank you.
Okay, thank you. I have no further speakers that I can see on either of the things, no hands up. So go on to page 40 and the recommendations. There are 3 short recommendations. I don't see any use in altering them. Somebody was sharing the page then.
Yeah, sorry.
Yeah.
I'm just trying to share the resolutions that were typed. I haven't done anything fancy to them this time. It's, as you say, very straightforward. I'm just trying to find the right screen to share with you. HASCOSC resolutions. There you go. So the first recommendation from the officer was that we consider the findings from the consultation process. So we have done that one. So the draft resolutions that leaves us with are: number 1, the committee endorses the proposed draft policy Appendix 1 for implementation from the 5th of April 2021. Number 2, that the committee recommends to the Cabinet that the policy be endorsed. And I'm happy to propose those 2 resolutions.
Do I have a seconder?
Yes, Chairman.
Okay, Councillor Bestow, thank you. Leanne, do you want to go to the vote, please?
I shall indeed. Just a point of my role, I do need to just say proposers, Councillor Martin, seconders, Councillor Biscoe. You are voting that the committee endorses the proposed draft policy at Appendix 1 for implementation from the 5th of April 2021, and that the committee recommends to Cabinet the policy be endorsed. I will now go through you all. I know a number of members have had to leave the meeting, so I will say all of your names in order. If you can tell me whether you're voting in favour, against, or abstaining. Councillor Biscoe.
Biscoe for.
Councillor Chopak. Councillor Chopak.
Councillor Chopak's got problems with her laptop, so she may not be available, Leanne.
Okay, thank you for that, Councillor Parsons. Councillor Ellenbrook.
In for.
Councillor Gammon.
For.
Councillor Jenkins.
4.
McCracken,
4.
Councillor Lennox Boyd,
4.
Martin,
4.
Councillor Nicholas, I believe, has had to leave the meeting, but I will check. Councillor Nicholas. She's not responding. Councillor Parsons.
4.
Councillor Pollard.
4.
Councillor Thomas. Councillor Thomas.
Yeah, 4.
Thank you. Tom.
4.
4.
Councillor Williams.
4.
So of the 13 members available to vote, all are in favour.
I think Councillor Jenkins has just indicated she's back in the meeting.
Yes, Chair, I did vote.
Okay, thank you. Just checking. Right, moving on straight on to item number 8, and that's the workforce update. Independent adult social care provider in Cornwall. Okay, I think, is it Miss Smith? Are you taking this on?
Yes, indeed, and I'm going to share a presentation in a moment. I'm
Okay,
co-presenting today with Mary Anson of Anson Care, who's one of the committee members of Cornwall Partners in Care, which is what the representative body for the independent and voluntary sector in Cornwall. So could I just ask Mary to introduce herself?
Certainly
Hello.
can. Mary, welcome, Mary.
Hi there, everybody. I think a number of you probably know me from the past because I used to be an attendee to this committee when I was a councillor at Kerrier District Council. However, I'm Mary Anson. I'm a registered provider. I have care homes in Redruth and Penzance, and I'm also a registered nurse. We have a tiny domiciliary care service, but not being on the framework, I'm not going to comment on dom care because I've only got about 12 clients. Thank you.
Okay, so can you see my presentation? Has it come up on screen?
No, Val, it's not at the moment.
Right, I will try again. Bear with me for just one moment.
Yes, it's up.
Wonderful. Okay, so this is a very short presentation just to illustrate some of the key points that were made within the paper and to give you an update on information where there's been further activity since the original paper was drafted. This slide is to give you a sort of a visual representation of the size of the independent care sector workforce. So as you can see, we actually have more jobs in the independent care provider sector than are employed in our community and acute hospitals. So we have something in the region of 13,000 individuals and 14,000 jobs. Councillor Toms, just for your information, we have identified since this morning that we have 285 NHS dentists working in Cornwall as well, but I can't give you any more figures on the rest of the dentistry workforce. So this next slide gives you a little more detail on the composition of the independent care sector workforce. We have in the region of 5,800 individuals working in care homes and nursing homes, 3,600 in non-residential, which is effectively home care, and 1,100 individuals who are FTE individuals who are in non-care quality commission settings, and that will include the personal assistants that we were speaking about on the previous item. The sector is huge. We have currently 328 CQC registered services, and you can see the breakdown. So the size of the workforce, we currently have a vacancy rate of 7.5%, which is comparable to the national average. And I'm pleased to say that that vacancy rate has reduced from 8.5% in the previous data collection. In terms of the makeup of the workforce, we don't have as many young people as we would like, and 5% are over the age of 65. The data that I'm presenting on this slide is taken from the Adult Social Care Workforce data set, and that is an online data collection service that covers the adult social care workforce in England. The data is used by government, by the Department for Health and Social Care, obviously local authorities and the CQC, and that's to help plan and to fund and to monitor the sector. In Cornwall, on the last data collection, just over 68% of our CQC registered providers completed their return, and that was a range of different sizes of providers, from the big providers through to the small ones. So I'll move on to the next slide. I hope that some of you will have heard of Proud to Care Cornwall. We have referenced it in previous presentations to the Scrutiny Committee. So we're part of a consortium of 16 local authorities in the southwest of England who agreed some years ago that it was important to pool our resources, our thoughts and our ideas about how we could raise the profile of care work. And those 16 authorities joined together some years ago, put some money in a pot, and set up a Proud Care website, which we've then developed locally and individually. So in Cornwall, it's facilitated by Cornwall Council, but it's very, very much a partnership working approach with social care providers, and more recently our NHS colleagues have joined us to be part of the Proud to Care initiative. So this slide sets out some of the key achievements. We do have an established brand and identity. Recently we were approached with our Southwest colleagues by the team who are leading the National Care Recruitment Campaign to compare ideas. So we do have recognition, and it's interesting to see that Proud to Care initiatives are popping up in other parts of the country outside of the Southwest. So people have seen what we're doing and are picking up on the ideas. We have a website, we have a recruitment platform, regular communications through a newsletter. We've developed a high-level workforce strategy for the sector, which is attached to the paper that you've received. And we have been successful in securing funding from Skills for Care and from ESF, the European Social Fund, to support the sector. So Cornwall Council has been successful between 2018 and through to 2023 in securing something in the region of £675,000 to support the sector, and other partners including Truro and Penwith College through the REACH project, the Chaos Positive People project, and other work, Dynamo Healthcare. Those organisations have also bid and been successful in securing funding to support the sector. So we have undertaken a number of recruitment campaigns during the life of the Cornwall Proud to Care initiative, and the most recent campaign was launched on the 9th of November. This is a joint recruitment campaign that we've been undertaking with colleagues from Health. It's a 12-week campaign to encourage people to apply for roles in the care sector. We've created a care recruitment triage team, which is open 7 days a week from 9 till 9. And that's been run by providers from the sector who have given up their time to be available to prospective candidates to encourage them to take up available roles in care. We've had media and radio advertising. We've had over 11,000 views on the Proud to Care website pages, and at the 4th of January we had 2,500 new users. So we can see that the campaign has generated interest. We currently have 107 jobs advertised on the Proud to Care website, and providers are feeding back to us that post-Christmas there has been an uptake in interest and applications for vacancies in the sector. So just to be clear, that the Proud to Care team, we don't recruit directly on behalf of providers, but we provide a platform to support their recruitment activity. So here are some of the materials that we've used in our various recent campaigns. These materials, some were created immediately prior to the outbreak of the COVID pandemic, and we will want to refresh our materials to make sure that they illustrate people using appropriate PPE and provide all the reassurance that you would expect. Our campaigns have used local people wherever possible in order to illustrate what care looks like in the county. So I'm now going to invite Mary to talk about some of the longer term workforce challenges that have been experienced in the sector. So Mary, could I hand over to you for this next slide?
Thank you. I wanted to just start by offering a brief history lesson, because to understand today, you need to understand the recent past. And this might help to explain, if not resolve, the crisis in social care today. So 50 years ago last June in 1970, I started my student nurse training. And in the years since then, there's been a huge demographic change. In 1970, opportunities for women were really only just beginning to open up. Going to university was for the select few. And in the 70s and 80s, the numbers were between 8 and 19%, and young men predominated. This left more women at home to undertake caring roles. Women in the 70s were still generally expected to go into nursing, teaching, secretarial or shop work, factories possibly in some of the more inner city areas. This was only about 15 years after the 50s era, when married women were still expected to give up careers such as teaching or nursing because they weren't allowed to carry on working and devote their time to looking after their husbands and bringing up their families. There were other changes in the 60s, which included the introduction of the birth control pill and the Abortion Act. These two measures dramatically reduced the birth rate. So constant falling of the birth rate, while welcome to individual women, has massively reduced the size of today's adult workforce at a time when many more people are now reaching the age of need for social care support. So the post-war baby boomers were the adult workforce of the 60s, 70s, 80s and 90s. Now these pre and post-war baby boomers are aged 100, 90, 80, 70 and 60-year-olds of today. We're all aware of the demographic time bomb of an ageing population, because those born in the 1930s, 40s and 50s and beyond now expect to live long lives, whereas for their parents born in the 20s, life expectancy averaged between just 50 and 60 years. Informal carers today are ageing as well, and I think that was raised by one of your councillors earlier. We have this rosy belief that everything was done better in years gone by and attribute deficiencies and problems of today as being the fault of something not being planned or managed properly today, which is definitely not the case. Pressures are increasing all the time. Those post-war baby boomers brought England back to posterity after the war, and are now, thanks to discovery of antibiotics and birth control, along with massive improvements in public health between the wars and ongoing, they are substantially the service users of today. Many are now already in receipt of services, and many more will be over time. Their time as pensioners and service users has clashed in time with the effects of the dramatic fall in the birth rate from the 70s onwards, which followed, as I've said, the pill and the Abortion Act, which enabled women to limit their families, to choose when or whether to have children, and to have them later in their relationships. So this leaves us with difficulties today. The children born in the 70s, 80s and 90s are today's adult workforce, but not only are there far less of them, they have many other opportunities open today that were not there for their parents and grandparents. University is an option for many, along with many other and different career options which barely existed in their parents' days. These factors have dramatically changed the available adult workforce. More options, less people. Further compounding this is the swing to single parenting becoming acceptable and no longer something to be ashamed of. So this smaller adult workforce may well not have access to childcare for careers which involve shift work. Tax credits mean women are no longer reliant on full-time work to make ends meet. Tax credits enable people to work part-time. So 50 years ago when I started nursing, a normal full-time working week was 44 hours. There are still people working today where the working week was longer again at 48 hours. Today, many of our adult workforce are able to live well with part-time work, and sometimes very part-time. Thus, as an employer, I now sometimes need 3 carers to cover the same hours. To cover the same hours where one person would have worked previously. This change has come about gradually over time, and it's becoming more acute by the day. People work in all sorts of jobs and careers which now didn't exist. We have to compete with supermarkets, retail, hospitality. As a kid in the 60s, I don't ever recall our family going out for a meal, but it's a way of life today. All of these service industries have expanded, and care, which has also exploded due to the ageing population and the success of neonatal care, which means more children are living with disabilities and now reaching old age themselves. We cannot recruit fast enough to meet the 24/7 demand of today's needs. Where does this leave us? It shows us now why we find ourselves with many frail and vulnerable older people, alongside a somewhat fragile and reduced social care workforce. Your officers, together with contributions from many care providers across the county, come up with ideas and strategies to enhance and promote care as a career. While the results of the many efforts being made do not always seem to reduce the care workforce deficits, it would be considerably worse if they were not doing what they're doing to raise the profile of care as a career, in the hope that we can encourage a positive approach to careers in care, in schools, and for young adults. Many of our workforce, like me, are actually baby boomers too, and when our carers retire, these carers who are baby boomers, we have to find not just more of the same, but also new ways of working and providing support. Regulation and bureaucracy means the skills required of today's carers are much more than they ever were when I first opened Kenwyn Nursing Home in 1990. Not, I think you'll understand, as my own, but for a provider long since bit the dust. And it's now a Barchester home. They not only must have the right values, but they need a level of education we struggle to find now in many of the recruits to care today because of those alternative options people have. We need people who are articulate. That wasn't necessarily required in the same way in my days at Kenwyn, where the responsibility for completing a care plan was limited to one adequate daily statement. Now they're reviewing care plans, they're writing them, they're drafting them, they're amending them, they're putting in a statement for almost every transaction that happens. And our staff find they spend almost as much time documenting as they do providing care. It's important that they do that because we have quite a litigious age. We live in a litigious age, and the only way that CQC and regulators and the service improvement departments of the council know how care is delivered is by scrutinising the evidence that's available. So although most of this reporting that we do isn't read by very many people, it's there because it might have to stand up in court later, and you yourselves need to know that the care is being documented so that you know that what we do for your service users is right for that person.
Okay, thank you. Could I thank you, Mary, at that point? That's a very personal and heartfelt view from a provider perspective. Were there any other points that you wanted to make, Mary?
I was going to move on to COVID.
Yes, thank you.
With respect to COVID, this has been a massive burden for the workforce and for providers and managers. Many staff are isolating, others are sleeping in the care homes for days at a time to support where there's outbreaks. Children in schools bring home an infection and require a parent to isolate. So we have more of a flexible workforce, which isn't necessarily a success. It's a bit of feast and famine, with staff roller coasting across the care world throughout the pandemic. We've got shielders who are off again, and remaining staff have to find ways to cover these voids in a time when perhaps not everybody can do shift work. So although we have trained some of our housekeeping staff, they don't want to do care work because they can't work evenings, or they don't want to work evenings. Housekeeping fits with school hours, and I would just put a plea: when you're putting in the hourly rates you want us to pay the staff, we want to pay our staff as much as we possibly can. But we have carers who say, well, I think I'll be a cleaner because I won't have to do evening work. I don't have to work weekend work. So I just want you to flag up that when I advertise for cleaner, I might get 30 replies. When I advertise for a carer, I might get 1. I had 20 chefs apply the other day. Now, I think that's a reflection of the pandemic, but I'm still not getting that number of care workers. And some of it is the shift work. It's not always about money.
Okay, so thank you, Mary. That's a description of what it's like to look to work in the sector at the moment under very difficult conditions. So I'll continue on with the presentation. So we're working together with NHS and colleagues from the provider sector to share our resources and to develop mutual aid and support across the organisations, including voluntary sector colleagues. I've talked about the recruitment campaigns that we are running. We're also working with our NHS colleagues to open up funded training opportunities to our colleagues in the independent care sector. The organisation Cornwall Adult Health and Social Care Learning Partnership are encouraging providers to access the Workforce Development Fund to support training opportunities for their staff. And we've had a plethora of resources and offers around staff wellbeing and support to ensure that we can share information with colleagues across the sector. In respect of COVID-19, we've set up regular weekly, twice weekly bulletins with the sector containing a whole range of information which is coming from a range of sources, government, Department of Health, and this is giving advice and guidance on infection prevention and control, wellbeing, information which is specific to the different settings, including care homes, COVID testing, and obviously the advice on vaccinations more recently. So future plans, I think we want to learn from what's worked well and do more of that in the future. We're working very closely with NHS colleagues at the moment to support care settings where they need additional temporary workforce as members of the workforce are potentially unavailable because of COVID and isolation. We're building mechanisms for peer-to-peer support. We're developing a nurse associate programme to address some of those issues which Mary has explained in her presentation. We're working on apprenticeship opportunities and developing pathways for careers across both the health and the care sector. And we're further developing the Proud to Care Cornwall brand. So the final slide is just a link to some resources which give more information about the Proud to Care website. So I'll stop sharing my screen at this point.
Okay, thank you. I have one question at the moment. That's Bert Biscoe. Bert, come in, please.
Chairman, thank you. And thank you very much. Mary, in particular, thank you very much for the extremely clear historical context that you set for in what you said. I thought that was extremely helpful. I would suggest, though, that also one of the things that the Mini and the birth control pill produced was the nuclear family, and that may well also have an effect on people's availability for work and so on. But thank you very much. I thought that was extremely good.
Thank you.
I want to make a suggestion, actually, Chairman. I welcome the report, and I understand everything that is said in here, and I'm very happy to commend the efforts that are being made. But I think, you know, I read paragraph 1.3, the perceived low status of care workers, etc. As a result, the high numbers of vacancies that exist at present will not be filled without attracting more people to come living work for. I just thought that's the last thing we want to do. We've got enough people here already. What we need to be doing is to try and get out the people we've got to actually do the work that needs to be done. So this is where my suggestion is aimed. And I'm very conscious in Truro, and I think this is true all over Cornwall, that the young, that is that cohort of people between the ages of, say, 14 and 20, or 25 perhaps, are in significant difficulty as the result of the restrictions and deprivations of COVID. And amongst other things, the prospects that they are looking forward to now in terms of work are very, very limited because of all the costs society are going to be confronted with and so on. So I'm also conscious that many of us who live and work in towns have things called business investment districts. And I'm thinking about how we might work up the partnership between further education and the local authority with the sector in order to create a sustainable training resource for people to work in care. And it does seem to me that there is the possibility that if those people who are operating throughout Cornwall with buildings were to consider the possibility of accepting an extra 0.5% or 1% on their business rates, that money could be brought together to form an endowment in order to support the provision of a training facility for young care workers, with a view to offering good quality training to reasonable, high levels of attainment for young people who are currently, and I think this will go forward for some time yet, who are having difficulty in figuring out what their life is going to be like, let alone seeing any real opportunities available to them. So I think this is maybe a moment to look at that. It would require some discussion with the government in order to get them to slightly amend the rules around business investment districts. And it is an idea, but the idea is to have everybody, particularly the trade, formulate to put together the means of developing an endowment to support the training and therefore the supply of skilled workers into the trade.
Do you want to come back on that, Anne? Valerie, sorry.
Just for Councillor Biscoe, there are a number of initiatives underway already. So we have some colleagues in an organisation called Dynamo Healthcare who have a training pipeline for young people to encourage them into careers in care. And they have access to some European Social Fund monies to support that programme. Our colleagues in the HASCOSC group have secured ESF funding to work with people who are furthest from the employment market to join the care workforce. So there are a number of individual initiatives taking place at the moment, which are designed to do exactly what you say, which is to encourage the uptake. But if there are more opportunities and other opportunities that we haven't explored, then of course we would welcome the chance to do so.
Well, I would certainly suggest that as something to explore. The thing about ESF funded programs is they'll run out in 2023, and what we know from all the indications of the government in terms of its substitute funding, it's going to be significantly less than we have been able to receive in the last 20 years.
Okay. So thank you, Bart. Moving on to Loveday, Councillor Jenkins.
Yeah, thanks for your very comprehensive report. I think it clearly highlights all the difficulties that there are in filling these vacancies. One of the things that well, there are two questions. One, which was right back at the beginning when you were talking about the data. In the data, do you count agencies that are based outside Cornwall but provide carers within Cornwall as part of your numbers of carers, or is that something that's lost in the data? That's my first question. I've got another one, but
my understanding, Councillor Jenkins, is that it includes all providers who have staff working within the Cornwall geographical area. But we can certainly check. I suspect it's a national data collection, so the granularity, we'd have to check the granularity, but I believe that's the case.
Right, it'd be interesting to know, because I think there's quite a lot of particularly living carers that come from outside of Cornwall but are working within Cornwall. The other question, which was a bit sort of left field, but one of the biggest issues for young people in Cornwall these days is being able to afford somewhere to live. And the rents are very high for the wages. Has there been anything explored about having providing young people who wish to be carers with accommodation as part of the package, so that they can actually have cheaper accommodation and a job, whereas the job on its own probably wouldn't be enough to pay for the rents that are being demanded in the market sector at the moment.
I know this is something that Mary has been wrestling with, and we've discussed on a number of occasions around accommodation. So I wonder if I could bring Mary in to respond to that question.
Yes, sure. Thank you. We bought a staff house at one time, and because we had a number of people, adults, wanting somewhere to live closer by. We have a number of staff who don't drive either. I just thought I'd bring that in because they can't all get to training easily unless we can provide it on site. So we bought a staff house and then had huge trouble being associated because of I think it's something to do with the gangmasters legislation, being able to charge a toll if it drops them below the national minimum wage. You can't take money from their wages to contribute towards it. So it's not easy. They do, if they're on a full-time wage, they do have enough to be able to do a shared house and take a tenancy, but they can't take it from us. I've actually got people living in a care home that I can't staff at the moment. So I've got 3 people living in a tiny home we've got in Penzance, partly because of COVID and partly because we just can't find anywhere for them to go.
I wonder if that's something that Cornwall Council could work with the care providers on, in terms of allocating social housing within, specifically for care workers.
That would be really helpful. I even thought perhaps the council would like to buy up some of the bigger houses that come up, because they're not as popular, they're expensive, but if you divided them up as a sort of, I had to live in a nurse's home for years, if it covers, so long as we've charged, included in the rent, their utilities and broadband, and they're just being charged a bedsit reduced rate, I think it would be a feasible thing to do, and we could put them in the areas of densest need for the population, and it doesn't have to be tied to any one care provider. It could be available for for domiciliary care, residential care, whatever.
Councillor Jenkins, we have been talking to our NHS colleagues about looking again at key worker accommodation, so that might be another route to see if there's any opportunities to extend anything more widely, but that's a conversation that's yet to happen.
Okay, thank you. Jonathan Price, you wanted to come in?
Yes, thank you, Chair. Just on that point, really, to say that I think there is the opportunity to look across with colleagues in housing at these type of arrangements moving forward. Clearly, as the report and Mary has set out, this is challenging at the moment, but probably will become more challenging. So I think all options should be considered. We can certainly take that away.
Okay, thank you. Councillor Colin Martin, please.
Thank you, Chair. Thank you for that report. Some quite frightening figures there coming in. Could you help me understand? We've touched on Brexit with the ESF funding coming to an end. Could you help me understand whether you think that there's any likely impact on the supply of migrant workers? I understand that's something that is perhaps more of an issue nationally than it has been locally, and maybe Cornwall's not as exposed to that risk as the care sector in other parts of the country. But then, if other parts of the country are calling out for care workers, might they move away from Cornwall to go and find jobs elsewhere?
Yes, Councillor Martin, we do have a significantly lower number of European workers in the Cornwall care workforce than you would see in the South East or in London, for example. And we did have some anxieties when preparing for Brexit that there might be a pull from the southeast of care workers from other parts of the country because of the comparative wages and whether it might be more attractive. We haven't seen that in practice. Mary has been recruiting up to the wire, up to the 31st of December last year, to bring in some workers from the European Union, and I think some of those have successfully joined Mary's business now, but we're not as impacted as some other parts of the country. Mary, did you want to come in there?
Just to add, I've never done it before, and I got panicky about October, and we went to an agent, and we have 3 Spaniards and 1 Italian now working with us, but we are having to provide the accommodation at the moment.
Right, thank you for that. And then the other part of the question then was, you touched on it, we're talking about the ESF funded projects that the HASCOSC group are involved in. We've talked more broadly on this committee about the wider determinants of health and the poor outcomes that Cornwall has on life expectancy and long-term illness, and that the biggest factor in that is getting people into decent jobs. So apart from the HASCOSC project, I'm not sure how big that is there scope for us as a council to put the focus on everybody who works with poorer, marginalised, out-of-work communities, to be driving them towards this sector of employment as a way to meet the workforce gap that we've got, but also to reduce poverty?
That's a big question, isn't it? Could I call upon my colleague Claire Hull-Davis, who is also on the call, just to talk about some of the work that's currently taking place under the ESF banner, because I think that might illustrate some of the activity, and in particular the scope of the HASCOSC project that's currently underway.
Yes, thanks, Val. And Councillor Martin, yes, the ESF projects Val referred to earlier were specific ones that we've got some funding for through Cornwall Council, but we have also worked more widely with the other providers, what are called the PA1 providers, so those providers that are receiving ESF funding specifically to work with those groups that you mentioned, you know, to highlight to them the work of Proud to Care, the vacancies that are available within the sector, and to promote the vacancies to their client groups. So we are connected with that wider piece of work, and yes, Positive People does work with a range of individuals to identify what development support they may need, and to work on sort of coaching to signpost them to appropriate employment opportunities, which does also include the care sector. So there's some specific organisations that work with care, but we also are engaged with those wider providers to promote the opportunities, and that's through there and through places like the People Hub as well. So the People Hub are working with those who, you know, may recently have been made redundant or furloughed.
Yeah, thank you. So it sounds like there's some good work going on there, but with the potential that might wind up in the next couple of years as the current funding stream comes to an end. So we need to really make sure that that is not wound down, but actually built up. And I think possibly did Rachel Wigglesworth have a hand up to make comment about those wider determinants of health?
She did. Rachel, would you like to come in, please?
Thank you, Chair. I just wanted to make the point, really following up from Councillor Martin's comment, that I think you know, there's good evidence that going into sort of the professions can, you know, improve income and future sort of employment opportunities. I don't think it's, you know, so clinical workforce clearly do experience that, but I think obviously from what the reports presented today show is that it's not necessarily seen that social care and caring professions have the same route to secure sort of necessarily good opportunities in the future. Clearly the progress has been made on the living wage, but I think what our aspiration should be is to make it a really you know, sort of attractive profession which has that progression opportunities, and I think if that's not built into the model, then people will leave to go into the NHS rather than stay in the care sector, and I think that is what can happen often as well. So really support the role of you know, the public sector in you know, progressing careers and giving good opportunities for good quality work, and I think, you know, clearly this is part of the step on the way. And the other thing I wanted to share is that my son has joined working in a care home as a care worker in the last couple of months as part of his not going off to do other things this year. So he's bringing back some experiences, and I think reflecting on the demands of the job, that the shift working that Mary sort of outlined is clearly can be suitable for younger people, but is also he's working above his contracted hours, and clearly in order to sustain at the moment the care sector, people are required to do above and beyond, and I think really acknowledge the stress on the sector at the moment, and we need to make these attractive jobs that people want to stay in as well as join. So acknowledging the challenges, but thank you.
We'll update the report. There are now 747 vacancies in social care. Thank you.
Sorry. Sally Hawking, you've just raised your hand.
Thank you. I was just trying to check for the right minutes to have in front of me, but I know that the last One Vision Board on the 7th of January talked about system-wide careers and work experience strategy. So sort of some of these things that young people were very much the conversations that were happening at that board then.
Okay, thank you, Sally. I know it was key worker accommodation was talked about when the Langgarth proposal was brought forward. Thank you. I have no further speakers, so we'll go to the recommendations on page 77 and 78. There we are. Those are the same three that are in the papers. Do I have?
Just to explain what I've done there, Chair, that the recommendation was first that the committee was updated on the current landscape, and it was just stating that we are going to receive it. So we've done that. The second one was recommending that we be assured of the support provided to the adult social care sector, and the third that we look for that the committee look for opportunities to promote careers in care. So the draft resolutions that members have typed up in the meantime are: number one, that the committee welcomes the report on the current state of the adult social care workforce and notes with concern that there are hundreds of unfilled vacancies today and a predicted net increase, 4,480 jobs to be filled by 2035. Number two, the committee commends the efforts of the Proud to Care partnership to raise the profile and public perception of the adult social care sector. Number three, that the committee investigates future funding options to replace the ESF funded projects. And number four, the committee calls on the council to carry out a review of housing availability and accessibility for care workers and other key workers. Obviously, some members mentioned earlier that they hadn't been able to take part because they couldn't see it on the screen. So before I propose those, I just want to give a chance for anybody to tweak the wording.
Do we have any comments from members of the committee? I don't see anything coming up, Councillor Martin.
So just to pick up then, on number three, for the committee to investigate future funding options to replace ESF funded projects, I'm not sure that the committee itself is in a position to do much investigating, and I'm wondering who we should be calling on to do that investigation. Is that anybody got any suggestions on that one?
Yeah, Chairman, I have. I think that it should be the economy section. I think that we should be talking to Glenn Kaplan and Tim Dwelly about it. I mean, because it's about the development of skills and employment.
Thank you. So I can see Councillor Jenkin is asking the Economy Directorate to investigate that. And perhaps if we add something slightly more specific on the end, ESF funded projects which target recruitment of marginalised groups into the workforce.
Can I suggest, Chairman, that you include the two magic words, skills development? That gets them more excited.
Whereabouts in the sentence would you like them to be?
Where are we?
Recruitment and skills development.
Investigate future funding options for appraisals of years they're funded for, which target skills development and recruitment.
Okay, thank you, Bart and Colin. Any other councillors wish to make comment?
Yes, please, Armand, if I may.
Yes, certainly, John.
I've lost that shared screen. I got it back. Yeah, okay, I've got it back. I was just going to make the point that we are a scrutiny committee, and therefore I think 3 and 4 should be referred to the portfolio holders in each case. That's Tim Dwelly and Andrew Mitchell.
Okay, thank you. The committee asks the portfolio holder for, what is he, economy?
Yeah.
And then what the committee calls on the portfolio holder for housing.
Housing, yeah.
Number 4.
I think he's actually portfolio holder for homes, officially.
Very good. And then last of all, the last recommendation was that the members of the committee look for opportunities to promote careers in care and promote the Proud to Care Cornwall as the brand supporting recruitment of the sector. Is that something we want to try and transpose into a resolution?
Chairman, could I just ask a question, please?
I was going to call you in when this part was, when Councillor Pollard had finished. Okay, Councillor Annenberg.
Right, okay. I'm getting extremely confused by all this. I mean, we have resolutions on the table, and so far today, every single one seems to have been tinkered with and played around with. Could I ask that if we are going to do this, if councillors want to do this sort of thing, that these sorts of ideas are actually brought forward before we go into the meeting? So, you know, by an email or something like that, because we seem to be spending an inordinate amount of time picking around on various resolutions. And I'm not saying it's the wrong thing to do, but in my only 4 years of being a member of 2 scrutiny committees, I have never sat in a scrutiny meeting where virtually every resolution has been tinkered with in this way, and it just drags the time out. It is now 3 o'clock, you know, and we're not even through the agenda yet, and it wasn't a particularly long agenda, and this is just, as I say, tinkering around the edges.
Okay, thank you for your comments, and they're noted, and I will speak to those involved about this, especially after what Councillor Barr has said. Right, we'll go back, and I think you've copied and pasted the item into item 5.
Yeah, so someone's done that. I'm happy to propose that as it stands now without any further faffing around and tinkering.
I'm happy to second it. That's lovely.
Okay, Leanne, can you take over now, please?
Thank you. So there are 5 recommendations on the screen. I will read them out for transparency and for members of the public who might be listening and not watching. So proposed by Councillor Martin, seconded by Councillor Jenkin. The draft resolutions proposed are as follows: that the committee welcomes the report on the current state of adult social care workforce and notes with concerns that there are hundreds of unfilled vacancies today and a predicted net increase of 4,480 jobs to be filled by 2035. 2. Committee commends the efforts of the Proud to Care Partnership to raise the profile and public perception of the adult care sector. 3. The committee asks the portfolio holder for economy to investigate future funding options to replace the ESF funded projects which target recruitment and skills development of marginalised groups in the workforce. 4. The committee calls on the portfolio holder for homes to carry out a review of housing availability and accessibility for care workers and other key workers. 5. That members of the committee look for opportunities to promote carers' careers in the care and promote Proud to Care Cornwall of a brand for supporting the company sector. Apologies for my tongue twister. If you're happy, we'll move to the vote. As usual, I will call your name out. I need you to confirm whether you're voting in favour, against, or abstaining. If people can turn their microphones off, and should I call their names just to ensure that they get feedback, I would appreciate it. If I can begin, Councillor Biscoe.
For.
Councillor Chopak.
For.
Councillor Ellenbrook.
For.
Councillor Gammon.
For.
Councillor Jenkin.
For.
Councillor Kirkham.
For.
Councillor Lennox-Boyd.
For.
Councillor Martin.
For.
Councillor Nicholas. She had to leave the meeting. She's not managed to come back. Councillor Parsons.
For.
Councillor Pollard.
For.
Councillor Thomas. Councillor Thomas. He must have had to leave the meeting. Councillor Toms.
For.
Councillor Ver.
For.
Councillor Williams. Councillor Williams.
For. I'm sorry, I got to leave the meeting now. I have another one. Sorry.
Thank you, Councillor Williams. So of the 13 members available to vote, all have voted in favour, Chairman.
Right, thank you very much. Moving swiftly on to item number 9, and that is updates from cabinet members. I think we'll, Councillor Hawking, you've been supplied with the updates. Are there any questions from members?
Sorry, Armand, if I could just quickly just say a couple of things. One is apologies to the committee for the tardiness with which you received the report. That was completely and utterly my fault and not Leanne's. I also managed to send Leanne a version which wasn't my final version. So what I wanted to add was that where I talked about the number of cases that the case review team were able to contact, I think it's also fair to add that we have trained some additional staff to fulfil that role. So we hope to see the number of cases contacted increase in the forthcoming weeks. Other than that, I'm happy to answer questions where I can.
Okay, Councillor Ellenbrook, please.
Yep, thank you. Could I just say to Sally, thank you very much for the now programmed in COVID update member briefings. Last week's was extremely helpful, and I appreciate, as a local member, having that sort of information so that I can share it with people who raise concerns with me. That's all I wanted to say. Very, very appreciative of the efforts that are being made. Thank you.
Thank you. And I think that another sort of recent development is that Whitney, part of the public health team, has been talking to localism, and we're hoping to be able to run out through the community networks that link officers ask you on a regular basis, what are your questions around public health? What are your questions around vaccines? And that if those all then come through, they're able to filter where we've got repeat questions coming in from different places, and make sure that we feed that in so that that weekly briefing acknowledges the things that are coming through as issues for councillors where we can. I mean, obviously that comes with the caveat that the vaccines information will be something that we're working with NHS on how much they're able to tell us in terms of those answers to those questions. So I think, as you probably can tell from various emails I've had that I've sent out to you all, it's not always the case that the questions that we're asking are answerable. But yeah, that's the process that we're hoping to put in place so that we can have a little bit more sense that what we're doing in the all-member briefing covers the things that people want to hear about. Can't hear you, Chair.
Councillor Kirkham. Yeah, Councillor Kirkham, you had a question.
I did, but I've now had a chance to look at Sally's update, which I wasn't able to look at properly. And I was going to ask about case numbers, and I see that you're saying, Sally, that cases are dropping now, which is what I was going to ask, and about the testing contact system, and that you're not able to make contact with everyone, but they all get an email. Is that kind of, are the numbers dropping to the point where you're able to re-engage with that now?
So in terms of the contact reviewing, the bit you're talking about there, that's the bit where I said that additional staff have been trained, so they should be coming on board. So we should see us getting a bit more capacity into the system. We're on to 286.5 per 100,000 for the last 7 days.
So it's dropping.
So it is dropping, but you know, I don't want that to be a cause for people to be partying.
No, are you finding that the lockdown is working now? In the last week or two, have things seem quieter? Certainly where I am. Is that something that you've noticed across Cornwall? Because of course you did a huge amount of comms at the start of the lockdown. Has that had an effect? Lockdowns are something where we see the effect, and that's where we can sort of chart the previous effect of lockdowns. So yes, it's good to see the numbers moving in the right direction. I guess I would be urging against any complacency over that. Just quickly,
I'm glad it's quiet in Falmouth. Let's make it quiet everywhere, please.
And outbreaks in schools and care homes, are they, because they rose quite significantly, didn't they, sort of around Christmas? Is that dropping back now? Do we have, is COVID still a big issue? Are we having new outbreaks in schools on a weekly basis?
So we're forwarding information to councillors about cases in schools, but we're just concentrating those on the ones that relate to people who are in the school building, so filtering out anybody who's who might have been in the system but hasn't actually been attending school, so that you just get the information on that. Care homes do remain a considerable concern.
Thanks.
Okay, and Councillor Martin.
Have I jumped the queue in front of Councillor Jenkins?
No, I think you were ahead of Councillor Jenkins.
Okay, fair enough.
You have, Colin, but go ahead anyway.
Okay, all right. Thank you, everybody. I'm just wondering, with the rollout of lateral flow tests, and I've had one of those, so I can get back into doing some teaching in a school. We know positive test results from that supposed to then lead to people going to get a PCR swab test. Have we seen that leading to an increase in the number of people having going and trying to get tests, or in general just the increased prevalence of the virus? Meaning, are we seeing a lot of pressure on the PCR swab tests? And are you able to tell us how many of those are currently coming back within 24 hours of the test?
I don't have the turnaround time to hand, but I can certainly make sure that's something that we cover in this week's all-member briefing. And I'm not aware of any pressures on the testing system at the current moment. I think there was one small glitch reported to me in the last week, where somebody'd tried to book on one that was 100 yards away from them and was sent to somewhere else, you know, that one that we've had before, and they were thinking that's weird because I can see it and I can see people are standing around twiddling their thumbs in it, but it wasn't repeated. When the public health team checked that out, they couldn't repeat that thing happening again for them, and reported that through. So I think sometimes we do see still those technical glitches. It seems to be an IT thing rather than any other part of the process, but there isn't suggesting that systems under pressure.
Yeah, I think possibly the fact that there are now some sites in Cornwall that are classed as fixed sites rather than mobile sites maybe solve some of those anomalies with the booking slots, because if I go on now at 3:15 in the afternoon, it won't offer me any slots at a mobile site, but rather than sending me to Plymouth, it might send me to wherever the nearest fixed site is now. We've got 4 of those in Cornwall.
Yeah, so in terms of the there isn't a lot of noise about problems with it, and there isn't a known issue with there not being capacity. So it's good to have got past that point, because as you say, the lateral flow tests will generate a bit more traffic too.
Yeah, thank you.
Okay, thank you. Councillor Lennox Boyd. Sheila.
Oi, Chair.
Oh, sorry.
Sorry.
Councillor
I'm
Jenkins
used to being
Lennox
ignored
Boyd.
when I'm in a meeting room, but being ignored when you're clicking on a list.
It's the way it comes through to me on the other machine. Sorry, Councillor Jenkins, please ask a question.
Thank you. A couple of things really. One, just to echo what other councillors have said about the efficiency and clarity of the messages coming out from you and from people in your portfolio. I think it's really helpful that we get clear messages. And so thank you very much for that. And the member briefings are really good as well. So I know it takes people away from the front line doing things, but it's also really important that we've all got the same messages to give out to our residents. So thank you very much for that. In terms of the case numbers and reaching the case numbers, are we seeing? I see you've got 30 to 50% that we're reaching. Hopefully, as Jane asked, that's going up a bit. But are we seeing that there are any geographical differences in that? Are there some areas that are under more strain than others?
As in areas of Cornwall?
Yeah.
So thank you for your kind words, and I will pass them on to the team. I know Rachel's had to leave to go to a DPH call, so I'm on my own here. But in terms of areas where we see particular issues, we then put in place the bits that you've seen happening in different areas where there's some targeted campaigns. So Newquay was one, and Callington at one point, Liscard where I am at one point. So when we see a particular issue in an area, that's when we try to put in those extra messages, and to use councillors to be able to get those extra messages out as far as they can through all different means. It's not always the case that high numbers that people see on the system equate to the case reviewers team belief that there's a particular community transmission issue in that area, because sometimes that might be when you've got another setting that's producing some of that volume of numbers.
Thank you.
Okay, Councillor Lennox Boyd. Sheila.
Thank you, Chair. And Sally, I would just like to thank you very much for all the support that you've given us. And we've been very fortunate to have you as a portfolio holder supporting us. And, you know, I've been on meetings when you've had to take it in the neck, when you've got an awful lot going on. So, you know, I reiterate what everybody else is saying. But this morning I had a message from Test and Trace. I got the right through, emailed. I had a test at 12:30, assisted test at Plymouth, admittedly at the range. And I was back to this meeting by 1:30. And hopefully I'll keep you informed as quickly as I can get the results back. But, you know, it's very, very efficient, and it was very quiet. So fingers crossed.
Thank you, Sheila. And you know, I appreciate the challenge that Saltash councillors have given me of late.
Thank you very much.
Okay, thank you. I have no further questions. Moving on to Councillor Rothschild. Any questions? No, I don't seem to have any coming up in the chat.
I'm really glad that Sally's got the portfolio she's got at the moment. Let me tell you, it takes the heat off me for a while.
Okay, thank you. As we have no questions for Councillor Rothschild, update from Councillor Colin Martin, please.
Thank you. Yeah, just two things to update you on. First of all, I mentioned last time about trying to get this children and adolescent mental health services one-day inquiry up and running. Thank you to those who came back in afterwards and said they were interested in doing that. Then followed that up with attending the Children's Health Committee recently, where they had a report on the youth mental health strategy from the commissioners there, and I had mixed feelings about it. One, it was tremendously encouraging that pretty much everything that we have said we were concerned about has been addressed in that strategy, and either over the last 3 years they have made significant improvements and solved the things that we've been raising concerns about, or where they haven't solved them, they have at least acknowledged that they're aware of the concerns that we've got and have plans in place to fix them. So in that sense, it was very encouraging. On the other hand, it kind of left us with, well, where do we go with this inquiry? Because they're in the process of doing a consultation on their strategy and asking the public, service users, service providers to comment on what's written there. Do they feel things have got better? Do they recognise the problems that need to be fixed? Well, that was exactly what we were going to be asking. So I'm kind of left feeling like maybe now's not the time to do our own parallel inquiry, using up council resources at a time of pressure to ask the questions that are being asked. So what I did though, I didn't want to sort of leave committee members with no opportunity to input at all. Now we can't formally ask for that same report to be brought back to this committee for us to scrutinise, because things can only be officially scrutinised in one place. But what I did get was an assurance from Liz Cahill, who's the commissioner, that as long as she's not called out to go and start vaccinating people, she will do an informal briefing with us where we can look at that report and ask her the questions to make sure that we're happy that she's on the right track. So I'm sure some people will have some thoughts on that, and I'm happy to hear back if you feel I've made the wrong call there. But it just seemed like at this point in the cycle we were in danger of duplicating resources. The other thing that I just wanted to mention was thank you very much everyone for bearing with us on the sort of continued experiment of putting our resolutions down on a Word document beforehand. Clearly some people liked it and some people had some problems with it, and I think Barbara Ellenbrook's suggestion at the end actually is incredibly helpful. For the next meeting I will set up a document like that when the agenda is published, and then we've all got the opportunity for several days in advance to look at it and put our suggestions down there. I think it is really important that the resolutions that this committee makes are the resolutions of this committee, not of officers. But it is important that everybody gets the chance to do it and that we do it in an efficient way. So thanks for that suggestion, Barbara, and I'll make sure that's done in a timely manner before our next meeting. Thank you, Chair.
Thank you. Councillor Ellenbrook, you did have a question. I'm sure it's about that same related matter.
No, I put a cross in and then I realised I shouldn't have put a cross in, so I put underneath ignore my cross, so I'm fine.
Okay, thank you, Councillor Ellenbrook. Thank you, members, for persevering. My update is
sorry, Ahmed, sorry, Chair. I think Councillor Parsons wanted to ask a question on something I said there.
Councillor Parsons, you come in, please.
Yes, two things. I agree with Colin. I think Barbara's suggestion was very sensible, but I do think it's important we don't just vote on what's presented to us and don't change things as it goes along. Going back to the inquiry day, I don't have any problem with us waiting until that's resolved, that their inquiry is resolved. I think that's very sensible. This is obviously going to go on into the next council. But what I would want to do is not to just accept what we're told as being absolutely right. I think at some point there needs to be some challenge to the public and to the people that use the service, so that they've got the chance to say what they really think about it to somebody that's not providing the service. I think one of the things we felt was a problem in the last inquiry we did was that people were reluctant to complain to the people that provided the service because they felt then that would impact on the service they've got. I'm sure they were wrong, but that's the way they felt. And when we actually delved into it, an awful lot of stuff poured out. So whoever's on the committee next time really needs to be poking around at the conclusions of that consultation. Thank you.
Yeah, thanks. And what I'll do as well is I'll share the link to that consultation. It's a public document. I think the window for consultation is probably open at the moment. And if we share it through our networks and ask people both to feed into the consultation, but also to tell us some of what they've said, then when we read back the results, we'll see whether it matches that reality of what we're hearing on the ground.
Microphone off. Is there a timescale on that, Colin?
I'll find out and let you all know.
Thank you.
Okay, thank you, everybody. Just a quick one from me. I'm a non-voting participant of the Outbreak Board, and I've got to echo all the things that have been said by various committee members about the good work of both Rachel, our Public Health Director, and Sally Hawkin, our portfolio holder. I congratulate them also on their abilities to communicate that most of what's gone on through the social media, through press releases, and something that I know was very popular, the Facebook Live that they did a couple of Fridays ago. Well done. You deserve all the credits that you get for doing what you've done. I noticed from communications coming around from all different angles that there is an increase in mental health and suicides. I know in my own area there have been a number of suicides in both my local area and the wider area. So I think that maybe I'll talk to officers about getting more and more communications out about mental health. The questions that I was going to, well, not questions, the parts I was going to get clarification on from Tracy, Miss Tansley, our 151 officer, was the fact that currently the percentage of rise in the precept from our adult social care precept at the moment, if we go for the 3% this year, will mean that it's put £167 on a Band C council tax, so that is quite significant. And the fact that those people that were in the all members briefing, I suggested that we should have a hardship fund, and she agreed with that. Councillor Pollard has been in contact with me in the last few days, and he's had a mental health briefing note. Well, it's a newsletter from another council, and I've sent that off to Ruth Goldstein to look at, and she says that she'll try and replicate it with the local information and get that out, because it was a very good and well written document. I know we are all desperate to get our injections, and I know that there's a lot of good work going on out there by a number of councillors. You know, we've talked about the ones in Saltash. Similar has been done in Lou, you know, and many other places. You know, I think Councillor Nichols said that she was working down in St Ives, so all across, and the councillors should take credit for, you know, some of the work that they're trying to get the local vaccination centres up and running, which will help the numbers and the progress of what's going on. I've got to agree with Councillor Martin about Councillor Ellenbrook's comments, and we will make sure that that's set up, and I hope Councillor Ver would like to see that as well, so that if there's any amendments, it comes in early and pre-meeting, so you've got time to look, digest and make a decision on it. That's basically my my report. It's been a long meeting, and I know you know, you're all tired, but are there any questions for me? And if not, we'll go to the very last item. Are there any questions? No. Okay, thank you very much. I've had no indications of any further business to be considered as a matter of urgency. I thank you for your attendance. I thank all the officers and Mary Anson, who came in and gave us an insight into the world of her care home, which was very enlightening in some aspects. I thank you all for your attendance today. I hope it's not been too long, and please go out and enjoy the rest of the day.
Thank you, Armin.
Thank you, Chair.
Thank you. Bye.
Yeah, bye.
Thank you, Chair.
Thank you, Almond.
Thank
Okay,
you.
thank you. Thank you.
Bye.
Bye.
Thanks, Armin.
Okay, thank you, Jackie.